Hello and welcome back to my channel. Today I am finally gonna do another pregnancy update, and when you're seeing this video, I will be 26 weeks pregnant. So let's get right into it and let's go over the last few months. If you guys are new to my channel, hello, my name is Briana and I am pregnant with my second child. I am having a baby boy, and last time our first child was a little girl, and she is 3 years old right now, and her name is Kaya. Okay, so a quick recap of 17 through 20 weeks. I put that I was still nauseous at times, but not much. And then started to feel the baby move, but can't feel it on the outside yet. So at 17 weeks is like the first time that I felt like I felt him move, but Kyle was 17 to 20 weeks, he was unable to feel it. Kyle's my husband. I started having a ton of heartburn, which I am still having. I also had heartburn a lot with Kaya. And then I noted that I think I might be swollen at times, but not bad yet. I said that because in my last pregnancy, I was swollen huge. Like my ankles, sorry, my cat's messing with the stand. Get down. My ankles got so big I could not fit into my shoes. I was unable to wear my wedding ring. I was huge. So I noticed that maybe like my feet and ankles might be a tiny bit swollen, but let me tell you, it is nothing like last time. Okay, weeks 21 through 23, I can feel the baby move a ton, and Kyle can also feel it now. So he started feeling it around 23 weeks. I started having what I think was round ligament pain. I don't know for sure, but it was very, very low, and it was like pain as I was doing something. So I don't know, just like when I googled it, everything about it sounded like round ligament pain, and I do not remember having that with Kaya. Also, I don't think I put on here, I didn't, but I thought I was having a couple of Braxton Hicks contractions. Like whenever I was doing a lot of something, like out for a walk or doing something like that, I would feel something, like feel the tightness in my stomach. It does not alarm me at all. I think that's normal. But whenever I went to the doctor this last time, she asked me if I thought I was having any kind of Braxton Hicks contractions, and I said yes, and kind of explained when they happened. And she said it very well could be, but more than likely, she thinks that that is not what I am feeling based off what I told her. She thinks I might just be dehydrated, which, you guys, the amount of water I consume is, I don't know how I can be dehydrated, but anyway, drink up on your water. The next thing, for 21 and 23 weeks, no food aversions, but my biggest craving this pregnancy is caramel apples. I cannot stop with the caramel apples, and that's actually gotten me in trouble, and I will go more into that in a second. My last pregnancy, my biggest food craving was chocolate milk. My last appointment, I had my anatomy scan, and I'm going to show you a quick little picture of him. He does finally have a name, but I'm going to do a name reveal video, so I'm not gonna say it here. But he actually just got his name. We actually decided officially on Halloween, so that is very new because today is November 3rd. But here, we found out what he was early with the blood test, so we were not shocked when we found out he was a boy at the anatomy scan. But here's a little profile pic of him. And then here's another cute one of him. He's kind of got like his hand on his head. So that was what we seen at the anatomy scan. He is perfect. Now of course the cat's gonna try to play with these. He's perfect. He at the anatomy scan he was measuring 5 days ahead of schedule, and at that time he weighed 15 ounces. But with him being 5 days ahead of schedule, that wasn't enough to change my due date, so he is still planned to arrive around February 10th. Sorry, February 10th. My weight so far, which I started at 134. What was my weight last time? I went to the doctor just last week. Sorry, thought I heard something. But anyway, I think I weighed 150.6 at my last appointment. So if I weighed 134, that's 16 pounds I've gained so far. And then I wrote in here for weeks 21 through 23 that my next appointment was my glucose test, and I actually already had that, so we'll get into that next. Okay. Just making a quick note to make a baby name reveal video because I wasn't planning that. But now that we have his name, I think I will. So I had my glucose test a week ago Monday, so I would have been 23 weeks when I had the glucose test. And also I should preface this by saying that I do not eat good. I've never had a good diet, and I don't now either. So, but with that, I also didn't have a good diet with my daughter, and everything was fine. So I had my glucose test a week ago Monday, and then on that week, on Thursday, they called me and said that my numbers were high enough to where I needed to go for the next round of testing. And they did not tell me what my fasting blood results were. I think I can actually look online and see on their portal, because I am kind of interested to see. But an hour, so what happens is you go in, or what happened for me, you go in, you fast and they draw your blood, and then you drink the drink. You have 5 minutes to drink the drink, and then you wait 1 hour, and then they draw your blood again. And when they drew my blood after the hour, my blood, my sugar level was 161 or 162, I can't remember. And when she called me, she told me that their cutoff was 130. So I know absolutely nothing about like what it should be or what's high or anything. And so they asked me to come in for the next round of test, which is the 3-hour glucose test. And so I was able to do that. Today is Tuesday, November 3rd, And I did that yesterday on Monday. I went in for the 3-hour test and I thought that I was going to go in. I fasted. They were going to draw my blood. I would drink the drink, and then in 3 hours they would draw it again. And also, side note, you know how you have the hugest irrational fears of your whole entire life, and for most people it's like snakes or spiders or something? Mine is blood. And so getting my blood drawn is hands down worst day for me. And I always pass out and cause this huge stink. So when poor little Dana in the lab, I know that's her name, when she sees me coming, she's probably like, oh, her again. But so anyway, I went in yesterday, and whenever they called me and told me that I would need to come back in and that my numbers were high, I was obviously very strict about what I was having from there on out, because I was worried that there was an issue, and feel like the issue is probably just my eating habits. So I changed that, and I did not have any stinking Halloween candy, nothing, not even a look of a sucker. My daughter wanted me to try her sucker and I wouldn't even do that. So I was on my best behavior for the weekend. I gotta sit on my butt. My knees are, or my legs are, my feet are going to sleep. But so, let me move this down a minute. Okay, so I went in, they drew my blood, my fasting blood, and then she informed me that, because I said, so what's the deal? Like, can I leave? Do I have to stay here? Do I just come back in 3 hours? And she's like, no. I draw your blood at the 1 hour mark, the 2 hour mark, and the 3 hour mark. And I go, what? You're gonna do what? And like, thank goodness I did not know that ahead of time, because I would have been stressing. So anyway, she said that they would let me go to my car if I wanted. So I would like go sit in my car and then go back in at the 1 hour mark, and then go back in at the 2 hour mark, and go back in at the 3 hour mark. So I had that done yesterday, and they will call me with results later this week. So if you guys are pregnant and eating whatever you want, be careful, because that catches up to you. So I will give you guys an update on once I hear back. I fully anticipate that everything's gonna be fine. Now that sorry, I got a text, but I fully anticipate that everything's gonna be fine now that I'm watching what I'm eating, and I'm more conscious of the things that I'm choosing. And it's funny because, like, while I know I eat a lot of bad things, I also was like kind of going over some of the things that I have day to day, which I wouldn't have called a bad thing. And both my father-in-law and my dad have diabetes, and they were both like, all of these things that you're naming are horrible. And they weren't, I guess I just I didn't realize, like, you know, like, I eat oatmeal all the time. I never pay attention to how much sugar is in anything. Even when I started to last week, I didn't even know what I'm looking at. I don't know what's a high number or not, and I eat a ton of fruit, and I had no clue that like some of that fruit had so much sugar in it. But anyway, I did know that the amount of caramel that I was having with my apple was not good. I knew that. I know that you can have a tub of caramel with your apple. But anyway, so I think that's gonna be it. I'm gonna give you a bump shot. And like I said, I'm 26 weeks. I'm gonna be 26 weeks tomorrow. So when you're seeing this, I will be 26 weeks. And I'll give you guys an update on what I hear back from the doctor. So stay tuned for the baby name reveal. I don't have a clue what I'm gonna do for that yet, but I'm going to plan it. So thank you guys so much for watching. Please consider subscribing if you haven't already. Give this video a thumbs up, and I forgot to do the bump shot. Ugh. And here is the bump. Okay, till next time.